Hello and welcome to Med Talks with Dr. Moin. Today we have Dr. Ranga Reddy with us. Dr. Ranga Reddy is President, Infection Control Academy, and he is also an honorary professor in Hyderabad Central University. Sir, welcome to our studio. Thank you for giving your valuable time to us.
Thank you very much, Dr. Moin. It is a great pleasure. In fact, I should commend all the good work you guys have been doing because in health, the most important thing and everything starts with awareness.
Yeah.
I think it is commendable how you guys are going about creating the awareness about the basics in the society, which can evolve into something really upgrading our health of the populations.
Yeah, exactly. As you said, like our motto is not only to educate the educated from the medical fraternity, we also want to educate the people who are not involved thoroughly into the medical fraternity. We all know World AIDS Day is celebrated on 1st December. And who doesn't know what was the impact of AIDS? How do you call it, sir?
Acute immunodeficiency syndrome.
Today we all know how to overcome that disease, and we have been fighting AIDS. So sir is going to talk to us about how to tackle AIDS and how to prevent it and how to manage it. Sir.
Thank you very much once again, Dr. Moin. And World AIDS Day is something which is a big instrument in terms of creating the awareness about HIV and AIDS.
Right.
HIV and AIDS had for very long been a curse to the humanity.
Right.
And probably it is one of those best examples of zoonotic infections.
Right.
Zoonotic infections for the public
it is something with the
which jumps, means the viruses, they jump from wildlife into the humans. If you go just back into the history a little bit,
okay,
probably in 1920s itself, probably HIV was there, okay, right? AIDS was there, where probably from the wildlife, from chimpanzees, probably the virus would have jumped into the human populations. But until 1980s,
okay,
we did not actually see much of those infections, and we did not record them,
okay,
officially. Okay. So 1980s onwards, we started seeing multiple outbreaks. Okay. Initially it was in Africa, then it actually has spread into other continents.
Okay.
Today, AIDS is everywhere. Unfortunately, today about 37 million people worldwide are infected with this disease. So far, we have lost to this disease about 36 million.
Wow, that's a big number.
Yes, since the times when we started actually getting notice of it.
Okay.
Since we have started making records of it, we lost about 36 million people. A lot of progress had been done, where the governments and also the UN and multiple non-governmental organizations and people like you, who are creating the awareness, there had been a considerable kind of improvement in terms of diagnosis, treatment, and also the awareness. But still there is a long way to go. In fact, the current pandemic which we are going through, the COVID-19,
right,
it has actually created a little bit of trouble because Corona has kind of blocked the people from getting the right kind of treatment and access to the public health.
You mean to say Corona has inhibited people from that HIV segment to get treatment?
Absolutely, because as you are aware,
right,
a lot of hospitals, both in the public sector and private sector, were not functioning to their full potential. And non-essential services were kind of closed for quite some time, which has actually caused a lot of trouble for the HIV patients, not only HIV patients, but also even patients with cancer, diabetes, and multiple diseases,
Right.
which are not kind of urgent, but very definitively they are very important. But since they are not urgent, the healthcare professionals and the healthcare segment, it could not give enough attention and necessary attention in order to give the treatment in time and also to save them.
Okay.
In 2020, we have 10 more million people who
Okay.
have joined into the stream
Okay.
of the new infections.
Okay.
And probably a few hundreds of thousands people would have died because of the disease and also because of the lack of attention, medical attention, which was supposed to be given to them.
Okay.
So, yes, as I said, world has seen a lot of improvement in terms of tackling the big problem called as AIDS.
Okay.
But we have a long way to go. In 2020, whatever goals were set by United Nations and also the World Health Organization, they could not be met for the reasons which we have already discussed.
Okay.
Probably we would see a lot of difference in terms of ensuring that new patients are not going to be added to 37 million people who are already suffering with this particular disease. And one of the main things for 2021-25 plan is to go with 95, 95, 95. This is a formula.
What is that, sir?
Yeah.
95, what is that?
Yes, it is a new formula, which UN has defined in order to take care of the awareness, diagnosis, that is the testing, and also the treatment. So all these three areas, you have to achieve 90% of your goals. So that is what is called.
Why not 100%? Humanly not possible?
Yeah, you always have gaps because healthcare system is not something homogeneous.
True.
Different countries have got different levels of their healthcare system delivery and also ability. That health equity is a problem worldwide. Right. Where there is a wealth, the people are getting better healthcare. Where there is no wealth, right. Countries in low, medium income countries and the poor countries like in Asia and Africa, even in part of South America, right. The people are not getting the equitable kind of share of attention to their healthcare needs. So, because of these things, we would not be able to say that, we will go for 100.
100. But, sir, the guidelines, the globally are one and the same, right?
Absolutely. But, the simple example is, what we are going through currently. The guidelines are the same. In some part of the world, you are now already getting boosters.
Access or inaccessibility, right?
Absolutely.
Right.
That is that makes a lot of difference in terms of getting or reaching the targets.
Right.
Would depend on what kind of resources the country has.
Okay.
What kind of external help the country can get. That is going to make all the difference. Guidelines, as you said very rightly, they are the same everywhere.
Sir, how is our country dealing with, like, looking back in the 80s, then 90s, now after that millennium and now today. So, like, how is our country meeting this challenge? Were they really very well prepared when they just discovered this problem? And are they dealing with it in the right way right now? And whatever the guidelines they have made and whatever the target they have thought of achieving it, are they on the right plan, sir?
I think more or less, yes. Initially, I remember as a student in the mid 80s when we just started hearing about AIDS, we had no clue, right? We had no clue, and it was pre-internet era, where getting the information was very difficult,
and there was a big fear,
and there was a lot of stigma. There was a lot of xenophobia, right. Because the people thought only black people would have it, and even if you are going to touch Probably you're going to acquire the disease.
Right.
And there was all sorts of ambiguity was there around the disease, the transmission, the diagnosis, and also the treatment. I think, as I said earlier, we have gone a very long way. India also has made a significant stride in terms of containing this disease.
Okay.
Traditionally India had one advantage, that polygamy is not something which is
very frequent. In our
it is not part of Indian
our culture. Right.
That actually had some kind of inhibiting factor in terms of not having disease going in a big way. But at the same time, since India has a predominant rural population,
right,
where education and awareness is a problem, so it took quite some time for the government to get a handle of it, and the NGOs have played a significant role in terms of creating the awareness, especially among the rural population, giving them the right kind of messaging, that this is not something which is going to be transmitted through the touch or something like that. This is a disease which would happen only if you are going to have the intimate relationship or the blood, through the blood infusion, etc., etc. So I think, overall, if you look at, I think India has handled AIDS very well. Although during 90s, there was a little trepidation in terms of how to communicate, because although we said initially the positive side of our society being a little conservative in terms of the intimate affairs, but at the same time that also had a fallout, that talking about sex, talking about these intimate relations was a big problem, because how to communicate that without offending the people was a big problem. But I think we have overcome all that. I think the health communicators have developed fantastic role models, fantastic communications. If you remember in 90s, there used to be an advertisement about a Puli Raja. That is So all those things actually have given a fillip to arrest actually this problem. On the other side, there was a government commitment. There was also NGOs and also WHO very actively engaging with the government. And the most other important block in solution to this problem was availability of the medicines. I think people like Yusuf, Dr. Yusuf from Sipla, who had actually made a tremendous difference in terms of actually making the AIDS drugs at a fraction of cost of those which are being sold by the MNCs, which had made a phenomenal difference to Asia and Africa in terms of the access to these drugs, which has also played a very vital role.
So initially they were very expensive, sir? Before
that?
Yeah,
I don't know if you remember, I just, when I passed out of university, when I was practicing in 94, 95, the drug costs in Europe or in US, it used to be per course about $40,000.
Oh my God.
$40,000 for treating one patient for one course.
And but one course was what? What duration was that?
Yeah, usually the initial kind of treatment plans, they used to be for 1 year, right? So for a 1 year kind of treatment, of course, that AIDS is not curable. You need to have lifelong medication. And in 1 year, if you had to spend $30,000-$40,000.
It's lifelong process.
Absolutely. So, there is no way, maybe you would not die of actually the disease, you would die of lack of medication because you cannot afford it. That is the problem. I think, from that phase, Indian industry, pharmaceutical industry has played a vital role, which has saved not only India and Indian patients,
but the outside world.
but entire world where affordability is an issue.
Sir, now talking about AIDS, can we come into a clinical picture of AIDS now? We are talking about AIDS globally, and we are talking about how AIDS came into the picture in 1920s and then into 1980s when there was a outbreak. Can we talk about the signs, symptoms, and how people get AIDS and how can we prevent it?
Yeah, I think that's a very important question. I think people should be aware that unprotected sex is one of the major, uh, kind of transmission factors. Uh, there is nothing to feel embarrassed about actually these things. The people should discuss openly, especially with the youngsters, to tell them to be protected.
Protect.
And in fact, a lot of Western schools and colleges would have the vending machines for the condoms.
Okay.
You see, we should not treat the words like condom, sex, and all that stuff as something very stigmatic. By labeling them as a stigmatic thing, we are going to unnecessarily perpetrate this problem. I think that is one thing which we need to be careful. Second thing is, since this virus can be transmitted through the blood. So whenever you are going to have any transfusions, you need to be careful. Of course, the blood banks need to be doubly careful in terms of actually screening all that. And when you are going to have any of
blood testing done, you have to be careful with the gadgets
absolutely
you're going to use. And nowadays we have all you single-use syringes.
Absolutely,
like previously
that is very, very important actually. But at the same time, although we have today most of the syringes and also the needles are single use, but because of ignorance at let's say RMP level, those are quacks who are at the villages, because of this, their just ignorance, sometimes just for the sake of 1 rupee or 2 rupees, they start reusing the needles.
Oh, is it, sir?
So that people should be aware. And whenever such situations where you need actually to be having any injections, you had to insist that it had to be a fresh needle,
and you have to make sure that they are discarding
absolutely
the used ones as well.
Yes, that is very, very important, because the needle prick is another issue, especially in the healthcare. Those nurses and also the ward boys, and also the cleaning staff, whenever they are handling with biomedical waste, especially the needles, most of them, they pick up these needles, and needle prick is a big problem. So all these things need to be aware of, and you have to avoid it so that you don't get into the problem of this. And as far as the symptoms are concerned, these are sometimes it goes very unnoticed. And most of the people they get diagnosed only when they are going to have the screening. So it is a good idea actually once in a while to do the screening, especially when you are going
in a medical profession, or maybe when you are just maybe assisting somebody who's not well, or maybe you are just assisting somebody who is going to the diagnostics and all.
Absolutely. And also probably I think now it has become very common that there is a premarital screening for the young people. Before just getting married, you need to do a thorough check, including on HIV, so that it is not going to be a problem for the future harmonious relationship between
Sir, there are 3 ways of getting contracted. We spoke about. One is through unprotected sex, second is blood transfusion, third is the needle prick. Sir, what about if the mother is infected?
Absolutely.
Will it be giving it to the baby?
Yes.
Or do we have some medication where we can stop?
Yeah, certainly. See, between the mother and the child, the transmission is a possibility.
Okay.
And it happens most of the time.
Okay.
But our science has really evolved where we are able to predict it. And also while giving, the ART, that is antiretroviral treatment, we would be able to effectively, ensure that the newborn is not going to suffer from the issues. I think, there is a significant kind of improvement which has been done, both in terms of disease diagnosis and also the management and the prediction actually, whether it is going to cross that barrier and, whether the newborn is going to get affected or not.
Sir, what do you advise for our viewers? Like some people, it is like naturally nobody wants to have AIDS, but at some part of their pregnancy, they come to know that they are like diagnosed with this virus. What precautions should the mother take to prevent her baby from having that virus or managing her viral load?
Well, no, that's a very important question. Um, most of the times, that's why nowadays it has become very prevalent that premarital screening is necessary,
Okay.
right? While when you do that, you already know
No.
that whether your partner or the future partner is infected or not. Then you can take the informed decisions. It is
Right.
not about breaking that match,
Relationship or yeah.
but it is about knowing, because everything had to be done
Right.
with the prior knowledge.
True.
After knowing also, if somebody want to get married, it is up to them, right?
Right.
Then they would also know what kind of family planning they had to do.
Right.
How do they go about it?
Right.
Are they going to actually first get completely treated, or manage actually the viral load to such extent that it is not going to be passed on to the fetal thing? So these are the plans which we can do. Unless we are informed, we will not be able to go in that direction. Second question is, theoretically, probably the would-be mom does not know that she is infected, and at some point in time, now of course all the antenatal checkups, it is also, there is a HIV check,
Right.
which is being done, where the people would probably come to a surprise at that
Right.
moment. But there is no reason now to terminate the pregnancy at that time.
Okay.
Right? They can continue with that. There would not be a big complication giving birth to such children, such newborns. It is not, science is already having the capacity and capability today to deal with such instances. So we need not worry. They need not actually terminate the pregnancy. They can go ahead, but they had to be under good physician and also the obstetrician and gynecologist observation, and taking care of actually the treatment protocols very seriously.
Okay.
Because now the antiretroviral treatments are evolving. Initially, if it was one or two products, today you have got a bouquet of products.
Right.
There are combination of 4 or 5 different retrovirals given as a single tablet to improve the compliance, because when you had to take 4 or 5 tablets, it is very difficult. So now what pharma companies are doing is they are putting all these molecules into one tablet so that it is easier to have the compliance.
Okay.
I think today with the current available medication and also the capacity of healthcare to deal with that, we should not be really worried about having the pregnancy continued.
So today we just came to know like how to handle this deadly disease. It's no more deadly because, as sir has said, we know how to detect it, we know how to prevent it, and if somebody has already contracted, we know how to manage it. And one good thing we came to know about AIDS is that AIDS is not going to kill the person. If untreated, the patient or the person may have secondary infections. The secondary infections become more dangerous and they are going to harm you. So if somebody has some questions, you should talk to your physician, you should talk to your friends, and the most commonly friend among you is that Google, right? You can just go through it and you can surf through this, what do you call those, the real websites which are like...
Absolutely. You need to always find reliable sources of your information, because there is so much of disinformation. In fact, recently we had a conference on infodemic, that is, like a pandemic. There is a lot of information about a lot of things, the veracity of which cannot be, really trusted. And hence you need to be careful when you are actually, trying to search for something. Go to authentic sites like WHO, like Ministry of Health and Family Welfare India. Likewise, there are institutions who handle these kind of problems. World Health Organization is another organization. So you need to go to the right sources so that you get validated information which is authentic.
Yeah, you should go to the right websites, trustworthy website, and on top of it, you have got lot of physicians around you.
Absolutely.
You can just take the advice of your physician who is in your neighborhood and get your life better. Sir, talking about the management of AIDS, sir, is it a one-time program or is it going to be lifelong? And what are the side effects of this antiretroviral?
Yes. Art is a lifelong thing.
Sir,
right?
is it in the form of one pill or multiple pills?
Nowadays, the pharma industry has really evolved with the treatments. Earlier, it was all about, the
Multiple products, right?
multiple tablets. You had to take multiple capsules. We call it as polypharmacy. Having different things. But today, pharma industry has really done a good job in terms of putting all these necessary components or the ingredients into one or two tablets. So that it is easier for the patient to not miss them or not having kind of inconvenience of having so many tablets. One thing certainly, as you rightly pointed out, this is not something like a 1 month or 1 year treatment. It had to be continuous. As long as actually the patient is alive, they had to have this kind of treatments going on. And your physician is the right person, your infection preventionist is the right person who can advise what kind of product, what kind of dosage, what kind of the duration, and also what kind of checks, intermittent checks you had to do. That means every 6 months or 1 year you had to do certain tests in order to understand what is the kind of viral load and all those things. I don't want to really confuse the people with too much of information.
Right.
What you need to do is you need to follow your physician instructions like sacrosanctum. That is what is essential. And you need to ensure that you are going to take the medications without any break. That is also very important.
Yeah.
So that you can live longer and live much more energetically, having the quality of life.
This was very useful information, Dr. Ranga Reddy. Thank you so much for visiting our facility. And for our viewers to know, you need not worry about AIDS anymore because you have lots of information available today. So you know how to prevent it, you know how to fight AIDS, and the treatment part is also very optimal. So you can just come across any of the pharmacies, or even you can go to any of the government hospitals where it is freely available.
Yes.
You can just avail all those medicines. And the most important thing is you have to watch yourself. Not you alone, you have to watch yourself with the help of your physician. Thank you, sir.
Thank you.